In this video, we will learn about tuberculosis disease. Tuberculosis disease is caused by a bacteria called Mycobacterium tuberculosis. Mycobacterium tuberculosis is a rod-shaped, non-spore-forming anaerobic bacterium. Its size is calculated around 0.5 micrometer times 0.3 micrometer. This mycobacterium is under acid-fast bacilli group. It has an amazing lipid barricade that is made up from fatty acid and mycolic acid. This mycobacterium main target is lungs, but it also can affect the other system as the disease worsen. Next is the epidemiology of the tuberculosis disease. Tuberculosis disease is ranking top 10 in the cause of death worldwide. In 2019, an estimated 10 million people fell ill caused by TB. 1.2 million of TB deaths are from HIV-negative people, and 208,000 deaths among HIV-positive people. In year 2019, Malaysia estimated an incidence for TB is 92 cases per 100,000 population, and death rate is about 4 cases per 100,000 population. Next, we move on to the pathophysiology of tuberculosis disease. A person can get infected by the tuberculosis if they inhale the vapor that contain between 1 to 200 bacilli. The droplets that contain the bacteria that pass through the mucociliary structure will go to the alveoli. However, it will be rapidly encircled and swallowed up by alveolar macrophages, which are the primary immune cells living in alveolar areas. A few results will occur due to the phagocytosis activity via macrophages, whether result in latent tuberculosis or primary progressive tuberculosis. The macrophages will put mycobacteria in a ready state on their exterior to the T cells. The process is called beginning resistance, which will continue for 2 to 12 weeks. The bacteria will keep reproducing until the colony has achieved an adequate amount for them to bring out the response from the cell-mediated immune completely. Development of granulomas on every side of Mycobacteria tuberculosis is known as its later protection, the aggregation of operated T lymphocytes and macrophages, which will produce a micro-surrounding that will restrict the duplication and growth of the mycobacteria. Later, it will kill the macrophages and rapidly create solid necrosis in the middle of lesions. The patients that have a lower immunocompetent will fail in entrapping the bacilli. The tissue of necrotic will go through liquefaction, and the fibrous wall will stop having formation integrity. The substance of semiliquid necrotic can flow into a bronchus or close to the blood vessel, which will cause the cavity at the original area and filled with air. All of these will lead to development of sign and symptoms. There are a few of sign and symptoms of tuberculosis. Chronic cough is the most common symptoms of tuberculosis. Tuberculosis patient can develop dry cough first, before develop cough that produces a lot of phlegm, which may be blood-stained. It called blood cough. Next, tuberculosis patient may experiencing weight loss. This is due to loss of appetite and difficulty in swallowing food. Other symptoms are such as high fever, resulting from the immune system try to overcome the mycobacterium in the body. Immune system also will trigger the body to increase the body temperature and causing the night sweat. The other symptoms that tuberculosis patient may experiencing are such as fatigue and anorexia. If some of these symptoms shows, people may start to see a doctor to start a diagnosis. Before we go to diagnosis, there are groups of people that also should see a doctor to get tested. Those group are people who have spent time with someone who have tuberculosis disease, people with high risk settings such as nursing homes, and healthcare workers who care for patients that increases risk for tuberculosis disease. Now, we go to diagnosis. There are several steps in diagnosing tuberculosis. The first one, which is the common test, is to check the sound of breathing. People with tuberculosis have an unusual sound of breathing that indicate the existence of the mycobacteria in the lungs. The next test is an X-ray or CT scan. This test will produce an image of lungs, and the doctor can observe the image of the lungs. The existence of Mycobacterium tuberculosis will be visible on the image. Tuberculin skin test (TST) is a test where a tuberculin will be injected into the skin of the forearm. The immune system will react to the tuberculin. After 48 to 72 hours, the bump on the skin will be measured. If the measurement is more than 15 millimeters, it means the person is positive tuberculosis. Next is sputum test. This test will determine is there any tuberculosis bacteria that can cause the disease. The last one is interferon gamma release assay or IGRA, a blood test that will be sent to the lab to be mixed with antigen and control. This test is more accurate than the other test. However, the test may be expensive, make it hard for lower income family to run the test. If the result from the test are positive, the patient need to undergo the treatment. Now, we go to the treatment of tuberculosis. Treatment of tuberculosis must be in combination of at least 2 drugs. Total duration of treatment usually involve minimum 6 months, 2 months for the induction phase, and the remaining 4 months for the maintenance phase. In case of resistance issue, the total duration of treatment will be longer than 6 months. Now, we look to the standard treatment first. Standard treatment of tuberculosis consists of 4 different types of antibiotics. They are isoniazid, rifampin, pyrazinamide and ethambutol. Ethambutol plays the action to protect against unrecognized resistant to any of 3 drugs. Combination of 4 drugs will be given for the first 2 months, while only rifampin and isoniazid for the remaining 4 months. Once resistance occurred, the regimen of drug need to be changed. Example of combination of drug consist of pyrazinamide, ethambutol or streptomycin. If patient resists to the isoniazid, without resist to the rifampin, isoniazid will be replaced by levofloxacin or moxifloxacin. If patient resists to isoniazid and rifampin, the condition is called as multi-drug resistant. Next is treatment to special group of patient. A patient that is associated with a kidney problem, dose adjustment is required based on the glomerular filtration rate. While any TB patient with a liver problem, the liver function needs to be monitored closely. However, there is no modifications to the standard treatment are needed for TB patients during their pregnancy and nursing. However, pyridoxine must be added to the regimen. In addition, we need to avoid antibiotics that can cause teratogenic effects. All the treatment are under DOT, direct observation therapy. Direct observation therapy was introduced to improve patient adherence to their prescribed drugs. In the DOT program, patients need to come to the healthcare facilities and administer their prescribed drug in front of the healthcare worker. Every single dose. That's all for tuberculosis disease. Thank you for your attention.